Our next speaker is an expert on the employment sector, on the employer sector in healthcare. Jon Gabel, he's a senior fellow at the National Opinion Research Center, and he's been doing 40 years of research. He doesn't look it, but 40 years of research in the field of health, financing, and economics. And prior to joining NORC, he was the vice president for health research and educational trust and the Center for Studying Healthcare Change. He's been devoting quite a few years to employer surveys, and he's got currently a big project now. He's directing a national survey of small employers for the Commonwealth Fund and an annual survey for the California Healthcare Foundation. And he's got over 140 articles, peer-reviewed articles, and 58 about in the prestigious health policy journal, Health Affairs. So please join me in welcoming Jon Gabel.
Well, thank you, Paul. Thank you, Margaret, for organizing the conference, which is my favorite conference that I attend every year. And I want to say, Jim, I'm going to say how Donald Trump would say it. That was really, really good. And I guess Donald Trump would say, this is going to be great. This is going to be great. So, as you know, I am for those of you who have attended before, I am a compulsive public opinion pollster. So let me poll you now. First of all, how many of you attended the conference last year? Show of hands. Okay, can't use the same jokes. Okay, so I have three questions. So tell me, true or false? Number one, HSA and HRA plans continue to grow nationally. Put your hands up if you think it's true. You are correct. Okay, number two. The small business sector is the economic engine of the U.S. economy. Put up your hands if you think it's correct. All right. That is commonly said. However, let us note that in 1977, small employers constituted a larger share of the economy than they do today. Number three. So since the passage of the ACA in 2010, healthcare costs have accelerated. Put your hand up if you believe it's true. The answer is false. The answer is false, and we will show that that has not been the case for employer-based insurance, but it's particularly true for Medicare. And now, if I can master there we go. Okay. So here's my presentation objectives. I want to document the state of employer-based health insurance in the country. I heard one of the candidates say 170 million. I've been saying 156 million from the CPS. I'm not exactly sure how we got a different number. To examine changes in these benefits over the last couple of years and to review national trends and premiums for the marketplaces or individual exchanges in the nation. And I'm basing this on two surveys. First is the KFF Health Benefits Survey, and last year the survey interviewed 1,997 firms, large and small, private and public. And the survey begins in January, and the interviewing ends in May. The response rate last year was 42%, not a good year. And as we know, interviewing is becoming more and more difficult. And you'll notice today that people commonly don't tell you what their response rate was. And we use statistical weights, those what a typical employer faces, the other what a typical employee faces. Most of the time it's going to be, what I will present will be employee-based. Now I want to say, normally I present California data, also trends in California. This year we were late getting started, but Mary Beth Shannon, are you here? Yes? We thank you for your support. And Chris, we thank you also. So let's go to the Commonwealth. So we collect data from all states. State-based exchanges, this is real work. Most of the other people who are trying to track trends on the exchanges do not have state-based data. We do 6 rating areas within a state. 2 are urban, 2 are suburban, and 2 are rural. And we collect data from all carriers within a rating area, but we randomly select the plans of each carrier. And we collect data on premiums, and we collect data on cost sharing. So let's go to the results. This is the graphic which has the history of employer-based health insurance. I'm going to just briefly go through the periods. Let me go back. This is it. Here we go. Okay, this is the period of restrictive managed care when HMOs were very prominent, when networks were narrow. Then we retreated from managed care due to the political backlash, and you can see the increase in premiums. Then we start moving to higher deductible plans, consumer-driven health care, and now you can see in recent years, we had one year that seems to have been we believe the sample was an anomaly. Let's go to, somehow these got mixed up. Last year, premiums up 4%. Overall inflation was negative 0.2%. Wages were up 2.8%. So overall, real wages were up 3%. And of course, if I listen to the political controversy, it doesn't sound to be consistent with our numbers from last year, because last year was a very good year. And let me say, the historic average from 2000 to 2015 was 7.3% increase in premiums per year. And we've been at 4%, 3% largely since about 2008 or so. Okay, how about the cost of health insurance? It is, for a single policy, it is now $6,200 a year approximately. And for families, $17,500 a year. So now let's put this in perspective. Note, PPOs are the most expensive at closing in on $20,000 a year, and the consumer-driven health plans are the least expensive for family, about $15,000, almost $16,000 a year. So let's put it in perspective. A minimum wage worker works full-time all year. They would earn $14,500 a year. The average compensation, wage compensation for a full-time worker in this country is about $40,000 a year. So if we compare this figure, $17,500, with $40,000 in wages, you can see from that how it will become more and more difficult to provide insurance to middle income and lower income workers. All right, this is the work from Kaiser on the exchanges. This was not this year's. This was from 2014 to 2015, where we recorded we came up with our final number was no change on the exchanges. Mind you, the prices had come in 2014 16% lower than the Congressional Budget Office had projected, and then there was no increase in premiums. So that may explain why this year, oh my goodness, did we get the wrong one? We got the wrong one here. It shouldn't, this year, if it says 0, it should be, this year it was 6%. 6% was our increase, which is lower than some of the other people have estimated. But again, we use state-based, and others often do not include the state-based exchanges. I want to say, if there's one thing that sometimes drives me nuts in studies and in the newspaper, is headlines that say, blah, 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 varies. Well, of course, everything varies, right? There's very few times that we come in with a standard deviation of 0. But if we look across at the exchanges, there really were dramatic differences. We had 8 states whose increases were 20% or more. We had 21% with double digits increases, but we had 7 states with negative increases. And the reason why the overall figure was 6% was because the 3 largest states, Florida and Texas, those 2 were negative. In fact, we have Texas at minus 8%. And California at 4%. So the big states, and we're weighting by population, the big states had very modest changes in their premiums. So let's look at what kind of health plans people were enrolled in. I think the big story is last year, the consumer-driven plans enrollment increased from 20% to 24%. So they continue to grow. Now, states like California and Massachusetts, which are big HMO states, they're not showing these kinds of figures. If you go into the South or the Midwest, the figures are very large, and a lot of very large corporate industries or firms are only offering consumer-driven health plans. You can see that the HMOs now at 14% were at their peak in '96 at about, it's not up there, but they were at 30%. They were the largest at one time. And PPOs, we're seeing that decline, but the reason is that the consumer-driven plans are really PPO plans with high deductibles. So this is premiums on the marketplace, and compare it to those for employer-based insurance. We will see, if you look at a 40-year-old who's a non-smoker, you can see that the premiums are lower on the exchanges than they are for employer-based insurance. But if you go to a 55-year-old, they're much higher. They're about 81% higher for a 55-year-old than for a 40-year-old. Now, these figures are all before the subsidies, all before the subsidies. But if you're above 400% of poverty, these are the premiums that you would face. And one thing that's happening is, as we've noted before, higher deductibles. Higher deductibles. So this includes plans that both offer deductibles and those that do not have deductibles. 80% of all employees today face deductibles. The figure was 60% about 10 years ago. Some of this is a transition from HMOs to high deductible health plans. And so it's actually a tripling of the deductible. I can say more than a tripling. It's about almost more than 4 times as much as it was back in 2005. And of course, this is what American consumers see. So we can talk about the slowdown in aggregate spending, but to consumers, what they see is what they're paying out of pocket for. And so they don't believe there's a slowdown. Okay, I think when we look at deductibles, we should look at one very important facet of it, and that is, does the deductible apply for an office visit, or does it apply to for purchasing for prescription drugs? Now, we got a different story on the exchanges and in employer-based insurance. In employer-based insurance, 35% of all employees have to face that they have to go through their deductible before their plan starts covering office visits. Now, if you've got 24% of all employees on a high deductible plan, then you can see why that is the case. But when we come to prescription drugs, we've got just the opposite story. We see that only 11% of employer-based health insurance have to face a deductible before covering prescription drugs, whereas we've got 82% of those in the bronze plans, 54% in the silver plans, 44% in the gold plans. Now, let me give you a huge caveat to what I just said. Of those people on exchanges, purchasing on exchanges, 56% have a cost reduction plan. If you are at 250% of poverty or less, you are eligible. If you buy silver, you get a cost reduction plan. If you're at 200% of poverty or less, you will get a plan which is essentially a gold plan or a platinum plan. And here's the deductibles for those who have the level for those with deductibles. And you can see that for employer-based insurance, it's about $1,200 now. Very substantial for those people who are moderate income or low income. And for small employers, it's actually $2,000, over $2,000. And you can see, again, that for the bronze plans, about $5,600, about $3,100 for silver. Gold is equivalent to employer-based health insurance. Again, the big caveat, 56% of those individuals who have exchange coverage have a cost reduction plan. So most of them have a gold plan or a platinum plan. And last year, did premiums go up dramatically on the exchanges? Well, they did for bronze plans. They did not for other plans. Got it. This is the average monthly contribution. The takeaway is $89, $413, how much the employee has to contribute. You can see this is about 4 times as great as it was, 3 to 4 times as great as it was around 2000. Interesting point, though, as a percentage of the premium, they have remained relatively constant. The percentage, 17% and 28%. I'm going to go through this one because of time. This is very important. This is the number of people covered by employer-based health insurance. And you can see the decline. If you go to 2000 or 2001, go to the middle line, 65% of employees in the U.S. were on their employer's plan. It's down to 56%. It's more dramatic for the small employers, 58% down to 45%. And if you look at it since we hit the recession, we've gone from 52% to 45%. So again, this is fewer employees. This is a long-run trend. Fewer employees are covered by their plan. And grandfathered plans, you can see the numbers of grandfathered plans are declining. If you are in a grandfathered plan, you are not subject to many of the regulations of the Affordable Care Act, such as community rating, essential benefits, no preventive benefits for free, no yearly limits. And so that number is declining for both large and small. So let me summarize. Premiums rose 4% in the employer-based marketplace. It's actually up from 3%, but we're in a long-term over the, since about 2008, we've been at low levels of inflation in employer-based insurance. There was 6% inflation on the individual marketplace, very terrible results in some states, negative results in 7. Deductibles continue to rise and now more than 3 times as great as in 2005. There's been a long-term decline in the percentage of people covered by employer-based insurance. Okay, now let me, in closing, let me quote Adlai Stevenson, who said, "Man does not live by words alone, although sometimes he has to eat them." So I will predict what I think for the future. I think, first of all, because it's an election year, I don't think prescription drug expenses are going to go up as much as they did in the past year. Overall, I think on employer-based insurance, I think we're going to be in about the same place. We're going to be around 4% or so, 3%, 5%, something along those lines in the next year. How about the marketplaces? Well, I think it was disappointing that the number of young invincibles have not enrolled in the numbers that were expected. And a major reason for this is, A, they don't know there's subsidies involved. B, they don't know what the deadline is. But I think that's made it, I think that's going to make it more difficult to have a moderation in premium increases on the exchanges. So I guess I'm predicting the same thing next year that occurred this year. Thank you.